Welcome to the What's Happening Birmingham video podcast.
Hello everyone, this is Jefferson with What's Happening Birmingham. Today I have the honor and pleasure of being with Dr. Wesley Willeford with the Jefferson County Department of Health. We're here to talk about a very important topic that everybody is hearing about in the news, coronavirus. So I wanted to bring the doctor on today to kind of dispel any myths and kind of tell you all what's really going on. Is it actually here in Alabama yet? So doctor, thank you for coming on.
Yeah, thank you. Appreciate it.
Great. I would shake his hand, but he's going to probably take one of these precautions probably to do this. So let's get started. So doctor, what is coronavirus?
Yeah, the coronavirus is a new virus that's been infecting humans since probably around December of 2019, so this past December. Now, coronaviruses in general are not new. They have been around for a long time causing human disease. This one, though, is the first time we've seen it start to infect humans. And it probably came from a close contact with animals in a what we call a wet market or a live animal market in China.
All right, okay. And how long did it take for it to spread here?
Yeah, so the first cases were reported probably in the very late part of November, very early part of December of 2019. And then really it took until probably mid-February before we started seeing cases coming over here. Some cases came here before then, but they were travel cases, people who had gone there and come back. And then a couple of weeks ago, we began to hear about possible person-to-person transmission in the United States.
All right, so is this the same thing as COVID-19?
Yeah, so COVID-19 is an internationally standardized name for this virus. It's just it's sort of a shorthand for what to call it. And so that's really the name of the disease that it causes. The virus is called SARS coronavirus 2. So there was original SARS virus in 2002, 2003. So this is SARS coronavirus 2.
All right, so what are the symptoms of it?
So the symptoms are, it's tough in cold and flu season because it looks a lot like the flu. The big symptoms are going to be cough, shortness of breath, fever, and sometimes muscle aches in this one. Muscle aches are more common in the flu than in this, but it certainly can happen.
So how long does it take for the symptoms to start showing up?
So that's another one that's been kind of interesting. It's probably thought to be what we call an incubation period, time between being infected and starting to show symptoms. It, on average, is about 5 days, but it can go as long as 14 days.
Wow, so over the weekend, I think they start saying about testing kits coming to United States. Has it came here to Alabama?
Yeah, so Alabama, the testing kits are available at the Alabama Department of Public Health. They had previously been at the CDC. Those are now kind of going out to other state health departments around the country, but Alabama does have that capacity now.
When will it come here?
That's a good question. So the as far as the test kits being available locally, not sure yet. That's something that we'll see going forward. There are some private companies that are gearing up to do testing, so that may change some of this as well.
And I think the number one thing after me doing my research, and people are probably asking you, who are the most at risk to catch this?
So right now what we're seeing is the people who are most at risk are going to be people who are over the age of 60 or people with other chronic health conditions. So, people who have diabetes, people who have autoimmune conditions like rheumatoid arthritis, Crohn's disease, or people who have weakened immune systems for other reasons. Those are going to be the highest risk people. And that's something that's been we've been talking a lot about, is like there are some people who die from this, and it seems like the people who need to take the most precaution are those vulnerable groups because they're going to be at the highest risk.
All right, well, I wanted to dispel some myths.
Sure.
Because usually you've been seeing this, like the face mask thing. Does this actually prevent someone from catching this?
That's a great question. So the face mask doesn't do so much in the way of preventing someone from getting it, but what it does do, if you're sick, you're coughing into it, it can prevent a sick person from spreading it. So I think that's the important distinction. So it's not the best for it's really not the best for preventing you from getting it, because one thing I'd say about this mask is that firstly, when you put it on, you have to keep it on absolutely perfectly all the time. And I may have I just put it on upside down. So you got to be careful when you put it on. The metal bar has to go up top, and then you squeeze it around your nose. And the problem is that people will not leave it alone like this. You're something's going to itch or scratch. Anytime that you have space here, air just goes straight in. So really what this does, it prevents you from spraying droplets outward. So not good for preventing disease, but good from keeping a person who has disease from spreading it.
Okay. So I guess let's move on to the precautions.
Yeah.
I know you've heard a lot of times people talk about washing hands.
Yeah.
That's the number one thing. Should you take a vacation right now? It would be,
That's a great. That's hard to answer, because one of the things that we're seeing is that this story changes day by day. And what I've been telling people is before you hop on a plane or before you get ready to go on a vacation, you need to check with the website with cdc.gov and see if there are any travel advisories before you go, because those things can change on a day-to-day basis. And someone asked me a few days ago, can I go to this city? And I said, well, when's the trip? And they said 2 weeks from now. I was like, I'm not sure what's going to be going on in 2 weeks. So I said, wait to see what's happening as you come closer to the date.
And this is a question I was thinking about when I was going back doing my research over this weekend, and I guess this goes for the parents. Should parents be thinking about, maybe I should not take my child to daycare possibly, because that maybe, exposure?
Yeah. So right now in the state of Alabama, we still do not have any reported cases or test confirmed cases. Now there is the possibility that there could be some that we have not tested for yet. That may be coming. But I don't think there's any need to hold kids out of daycares or hold kids out of school at this point. That could be the case in the future, but I don't think we're there now.
I heard another term in the news about this whole thing called self-quarantine.
Yeah.
Where you basically, you have to stay at home for 14 days or whatever. Talk a little bit more about that and how that slows the disease down.
Yeah, so the idea behind a self-quarantine is that, and the reason we say 14 days, earlier I said that people can have that, the virus can be incubating up to 14 days. That's where that number comes from, is really trying to give you the maximum window where you're not going to spread the disease. Because if you're staying at home, you try to stay out from the public, those are less chances, one, for you to get the virus, but usually people won't be quarantined if they don't have the virus. But more importantly, it's if you have the virus, it decreases the chance of spreading it to other people. Because this virus is easily transmitted through what we call respiratory droplets. So there's fluid and moisture inside your lungs. When you cough, when you sneeze, it gets sprayed out. And that's what really transmits the disease. So by staying at home, you're preventing yourself from spreading that to other people.
And there's another thing, too, and a lot of the germaphobes probably think about this. Money. Is that cash and touching the...
I wouldn't worry about that, because the thing I think that probably at maximum this virus can really remain able to cause infection after probably no more than 2 hours. So, it's one of those things that, it's why we talk about environmental cleaning.
On the surface.
Exactly.
On the surface.
So sitting on a dollar bill, sitting on a piece of paper probably is not going to be infectious after 2 hours. And that's based off how other viruses like this one have behaved in the past.
Well, of course, I never like to ask a dumb question. I know some people are thinking, can you get it from kissing?
If you have someone who has the virus, I think it's very possible that you can get it from kissing.
Wow.
And that's just because, if someone's breathing close to you, you're in close, really it's being closer than 6 feet. I imagine if you're kissing, you're quite a bit closer.
Well, I guess we're really close to each other right now. So, I know this is another question too, because when you start Googling things, everything starts to show up. Can you catch it from your pet?
So there's actually a little bit of debate on this. I don't think anyone can easily catch it from their pet. Now, I think there was a report out of China about a dog that may have become infected with it. So what I want to say is that the virus, it's very unusual for viruses. Let me say not unusual. It's very hard for viruses to go from one animal to another animal. Now, the viruses can go from one of the same animal to one of another animal very easily, but it's hard to make a jump to a different type of animal. So I would say it's very unlikely that a person's going to pick it up from a pet.
All right, so other than vaccines right now, what are they doing to treat it? People come in contact with it?
So the people who get sick from it, what we're doing is called supportive care. So in the hospital, it's one of the things probably one of the biggest things that a hospital does is if you have a bad pneumonia, you get put on oxygen to support your lungs to make sure that you're able to live. If you get dehydrated, they can give you fluids. They can do a lot of other things to monitor you inside the hospital. So it's more of that supportive care. Unfortunately, there's not a proven therapy right now. There's some that may work, but some studies have to be done to make sure that those therapies actually will work.
What would you tell employers that possibly, because this started happening in 2 weeks, that's a whole lot of time off of work.
Yeah.
What advice would you give to them as kind of how to monitor it and catch it and trying to see?
Yeah, so the biggest thing for employers is really to understand that, in the coming weeks, depending on what happens, we could see people having to be out of work.
Okay.
We could see people having to take care of their children.
Okay.
We could see people having to take care of their parents or their grandparents. And that, trying to be as flexible as possible during kind of a more difficult time. Now, again, don't know if that's going to happen.
Okay.
But it certainly is something you got to think about. It's something that you got to make considerations for.
All right, so any final thoughts you would like to give to the audience? You can stay on camera, just tell them,
The biggest thing I would say right now, and I beg and plead with people about this on a daily basis, if you can, get your flu shot. Now, let me tell you why to get your flu shot. Flu shot is not going to protect you from having the coronavirus, but the one thing that it can do, it can decrease your chance of getting the flu, which is still out in the community and is going to be in the community for quite a while longer. And the reason that's important is if you don't get the flu and you don't get sick from the flu, then you're not going to be going to the hospital because you have the flu. You're not going to be going to the doctor's office because you have the flu. If we have a lot of transmission of this coronavirus, our hospital systems, our doctors are going to be stretched so thin that they're going to have trouble doing their job.
So you shouldn't just go to the emergency room and be like, oh, I think I got it.
Exactly. We want to be reasoned about when we go. So, it's part of the thing is like, I've said to people like, there's a coronavirus vaccine, you take it, but you won't take the flu shot.
Okay.
I'm like, no. So that's what I really want people to do. If they can take the flu shot, please do it, because that's one less thing that our healthcare system has to worry about.
And another thing too, is like, I know a lot of people think, well, this just depends on the immune system. Like if your immune system is strong, you probably won't catch this, but if your immune system is weak, what do you say to people?
So the immune system is one of those things that it's hard to quantify like you would like a $20 bill. $20 bill is $20. Immune systems are all a little different, but the fact of the matter is that if you come in contact with this virus, it is almost assuredly going to cause infection in people, because if it goes in through the nose, goes into the lungs, no matter how strong your immune system is, it can still infect you. Now, what happens after that may be a different story, but just because a person has a strong immune system doesn't mean that you can't get infected with it.
All right, and one last thing, I promise last thing, about cleaning products.
Yeah.
I've seen a lot of like Clorox, disinfectant wipes, things like that. Are those the best things right now to kind of...
Those are great. Okay. Those are absolutely great. So all the standard cleaning products, the disinfectants, the things that you wipe on surfaces, they're going to work on this virus, because it's there's nothing special about the virus.
Okay.
It's new in the sense that we haven't seen it before, but the way it's made is no different than a lot of the other viruses. So those cleaning solutions, they're going to take care of it.
And another thing, I know y'all was like 100 questions. Public events. I know a lot of people are very scared on springtime about to catch up, concerts. What's the likelihood, I'm not trying to throw out a number, that it's like, oh man, I think I'm going to catch it if I go to this public events. Because a lot of events have been canceled already. Yeah.
Anytime that you have a large gathering of people, your chances of catching something goes up, because the more people you have in one place and the tighter you have them, the easier it is for something to spread. And as of yet, certainly in Birmingham, certainly in Jefferson County, in Alabama in its entirety, nothing has been canceled as of yet. But that being said, we're going to have to stay tuned. Things may get canceled in the future if we start seeing a lot of spread of this virus.
All right, so Doctor, thank you for coming on. Well, no one can shake your hand.
Bad
Everybody shake your hand. If they want to get in contact with you, what's the best way?
Best way would be look at the Jefferson County Department of Health website.
Okay.
And then there's some numbers there for questions.
All right. Well, Doctor, thank you again. Thank you all for watching this video. Please check out what'shappenedbirmingham.com for more videos. And don't forget to subscribe to my YouTube channel. Thank you all again. And wash your hands, wash your hands, wash your hands. So have a great day. Bye-bye.
Thank you for watching the What's Happening Birmingham video podcast. Please check out our website, app, or subscribe to our YouTube channel for the latest videos today.